Nerve Tissue Healing by Carly Beck, Casey Sloan, Alexis Calhoun, and Jesse Hopes. The events that occur in the healing process of this tissue. The process of healing the nervous system. First, the peripheral nervous system healing. During the first 3 to 5 days, peripheral nerves go through a degenerative process called Wallerian degeneration, which is promoted by the immune cells, Schwann cells, in the distal axons. These cells produce an inflammatory response along with pain by producing pro-inflammatory proteins. Like how all other healing processes overlap, so does this one. While Wallerian degeneration is occurring, the Schwann cells are also undergoing mitosis to promote the best environment for this regeneration. The proximal area of the trauma starts to develop branches to grow into the damaged area. If a branch makes contact with a Schwann cell, there is a likely chance of regeneration. Surgery may be helpful, but it does not guarantee. Continuation of the process of healing the nervous system. The peripheral nervous system, only one proximal branch will form a new axon and the others will degenerate. As regeneration occurs, Schwann cells will remyelinate the regenerated nerve for protection. Remyelination occurs within 8 days post-injury. Now, the central nervous system healing is totally different than peripheral nerves. Peripheral nerves have a greater chance of regenerating than central nerves. This may be because peripheral nerves have Schwann cells and the central nervous system does not. And research has shown closer to the spinal cord, the greater the loss of the neurons.
Signs, symptoms, and treatment options. So a few of the symptoms that a patient may be experiencing with any sort of nerve damage can be pain in the area, maybe some possible numbness or tingling. They can have sensitivity to touch, and there may also be balance and coordination issues depending on what nerve was damaged. Also, depending on the extent of the damage, these symptoms can be experienced in one localized spot on the body or among an entire limb or area, just dependent upon how many nerves are damaged and where. There are multiple treatment options with nerve damage, and it kind of depends on what exactly happened. So one of those options is rest with proper healing. So if healing is going well, you can just rest the nerve or area of the body, and that can help. You can also add medication such as ibuprofen to help relieve pain that is experienced from that nerve damage. You can also have physical or occupational therapy to help improve those activities of daily living. And surgery, as Casey mentioned, can also be required if it is completely severed and beyond repair. So if none of those first 3 things are working, a patient can also have surgery. To restore function to that nerve alongside that treatment, there are also different options you can experience. You can use a brace or a splint, and this can keep that area of the body that was damaged in position for maximal healing conditions, so especially with hands and smaller limbs that can be used. You can also use an electrical stimulator, and this will just help activate muscles in the area that was damaged during a nerve severing. You can, as I mentioned, you can use physical and occupational therapy, and this will help a lot with those activities of daily living that may have been damaged when you were in the accident, or exercise, and this can help improve muscle function of that same area along with just stimulating them.
How can a clinician make a reasonable clinical determination as to the progress of the healing process of the tissue? So, nerves are the slowest healing soft tissue. It only grows around 2 to 4 millimeters a day, and there are other things that play into factors this, such as a person's age. So someone who is a lot older, like in their 60s or 70s, will have a slower amount of time or a slower duration of healing. And then someone who's younger, like in their 20s, such as us, we're going to have a quicker nerve regeneration. There's also the degree of injury and the site of the injury. So the PNS has a greater regeneration than the CNS just because it is further away from the CNS. The further the nerve injury, the less amount of time needed to heal. Nerve growth is aided by Schwann cells, axons, and stem cells, so the more you have of those, the quicker you'll heal. And this is the most frustrating for the patient because the timeline is so long and they can often feel as if nothing is happening. So there are a few type of tests that we can do at our clinical sites without much tools. You can do a manual muscle and reflex test. So these are easy to do. It requires only the patient, an examiner, and a reflex hammer. So for manual muscle testing, you want to do a short duration testing of the muscles for 5 seconds or more. This allows the muscles to fully contract for a few seconds and you can feel the spasms if there is one. And you can you want to test the muscle groups that are innervated by that nerve. Or if there was a nerve injury to the hand, you can test their pinch grip or their pinch and their grip strength. Or you could do sensory tests. So it could be something as simple as taking a tape measure and placing it at the same spot every day and recording the distance that the patient can feel the sharp or dull sensation that you do. Or you could do a Symes-Weinstein monofilament test, which is a grading of cutaneous pressure thresholds. It's a scale of 0 to 5, so 0 would be untestable, they didn't feel anything, and then 5 would be normal touch. There are other simple tests that you could do, such as identifying temperature, texture, shape, and thickness. If you are at a hospital setting or if you want to refer your patient, you can use a EMG, which measures the muscle response, which is innervated by the nerve. These are done by placing electrodes in the muscle that record the contraction of the muscle. Or you can do a nerve conduction study, which measures speed and strength of electrical activity of the nerve. They do this by placing electrodes over the nerve and sending mild pulses through. And then there are other electrodes that are recording.
Is there anything a clinician can do to determine the readiness of the healing tissue to withstand the stress of athletic competition? To determine readiness, it is important to look at all medical factors, including the location of the injury when returning to play. Location, what is the location of the nerve damage and what is the function of the nerve injured? So obviously, the closer to the CNS, the faster the healing can occur, leading to quicker recovery. So the more distal, so to say, the injury is going down the extremities, the quicker the healing will occur, and the better off it is. Diabetes also plays a huge role. With diabetes, you can have neuropathies, which is distal extremity nerve damage. So this is it's already been damaged. So if you have furthermore damage, it can cause a lot more harm. But you also got to keep in mind when returning them back to play that they already had some nerve damage. During diabetes, there's also peripheral vascular conditions that can occur, and so this just affects on like the healing of the nerve as well. And also with diabetes, there's reduced immune response, which can affect any injury. Smoking also affects the healing. Nicotine is a vasoconstrictor, and then nutrition and medication can also affect the healing. So you just want to make sure whenever you're returning them or clearing them to play that they're over all of this, or you consider all of these health factors. Most importantly, when clearing to play, there's not really a definitive way of clearing patients other than like the types of tests there are. So depending on the type of nerve injured, there's feel, temperature, pain, muscular, etc. You really just gotta figure out what kind of nerve you're dealing with to assess the test you're going to use.
So to wrap all this up, we just wanted to include a little clinical example of how rehabilitation goes with nervous tissue, just because it's slightly different from all the rest of the types of tissue. So for our example, a female patient that is 30 years old was in a motor vehicle accident, and she sustained a mild traumatic brain injury. She struggled with her balance, her motor function, her memory, and even had some attention deficits, so this was all affecting her activities of daily living. Her symptoms persisted for over a week, and she began physical therapy shortly after the accident occurred. The treatment goal of her physical therapy sessions was to improve her motor function, but also her cognitive function, and these two factors go hand in hand. So she began by performing activities such as walking, going up and down the stairs, balancing on a foam pad, etc. And while these physical activities in themselves were helping her motor function, they were not enough to also improve her cognitive function, which was the other goal of our therapy. So to see changes in both areas, specific tasks were added to these physical activities. So, for example, the patient was asked to walk at a comfortable pace on a treadmill while also talking at the same time, and she would also balance on the foam pad while reading from a vision chart. So these tasks allowed her to challenge herself physically and mentally, and this produced better and quicker results throughout her therapy.